Hi friends, good evening. How are all of you? Hope you all are doing great. So this is your Julie back again with a new video. So if you are new to my channel, kindly like, share and subscribe and don't forget to hit that bell icon. So welcome back to my channel, and today we are going to deal one of the very interesting topics. So that is about international patient safety goals. So those who have worked in an NFBA JCI accredited hospitals or who have worked abroad, they are pretty sure about what is international patient safety goals. So friends, what is international patient safety goals? This is we have 6 points in international patient safety goals. Let's see one by one. First is identify patient correctly. Second goes improve effective communication. Third is improve the safety of high alert medications. Fourth is ensure correct site, correct procedure, correct patient surgery. Our fifth point is reduce the risk of healthcare associated infections. Number 6 is reduce the risk of harm resulting from falls. So these are our 6 international patient safety goals. So friends, if you want to work abroad, this is one of the favorite questions asked by our examiner or our exam panel, because you should know what is safety of the patient. Safety of patient is very prior important. So that's why we are nurses. So what's our role and responsibility? That to take care and ensure the safety of our patients. So now the healthcare system is very improved and advanced. So they have come up, the WHO has come up with the international patient safety goals, so that these guidelines are followed by each and every one of you. So let's see one by one. What is identify patient correctly? So identifying patient correctly is you will identify the patient on admission using two unique identifiers. So what are the two unique identifiers? The complete name of the patient including the MRN number. I repeat, the two unique identifiers, that is the complete name of the patient and the MRN number. So why is this so important? On admission, so that the registration number and the MRN of the patient are clarified and checked. So before any invasive procedures, before performing any blood transfusion or any investigation, you have to check the identity of the patient. Before you go for any procedure, ask the patient, what's your name? So the patient will tell, my name is Abdul Rahman. So you will write Abdul Rahman. You will check with the ID band. Yes, this is Abdul Rahman, correct. Then you will identify using the MRN number. What is the MRN number of the patient? For example, 1, 2, 3, 4, 5, 6. So yes, you will check with the registration and you will check with the ID band if the number matches or not. So that's the two unique identifiers, that is patient's name, complete name and the MRN number. So friends, now we will see what is improve effective communication. So improve effective communication is establishing a clear documentation. So what is an example of this? That is reporting critical values using readback and confirm policy, using MRN number and the full name of the patient. So for example, if a laboratory technician is calling and informing a critical lab value of a patient to a doctor, he or she has to inform the name of the patient, the full name of the patient with the MRN number and his or her critical lab value. Then the doctor has to repeat whatever the laboratory technician has told, so that there is a confirmation and a clear communication regarding the patient's documentation. So that is coming in improve effective communication. Also, this is used in a handover process, that is we are having a ISBAR. What is this ISBAR? Is introduction, situation, background, assessment and recommendation. Now our third IPSG goal, so that is improve safety of high alert medications. So in my previous video I have clearly explained about high alert medications. So what is high alert medications? in a healthcare settings we are using high alert medications. So when we are using a high alert medications or a Lassa drugs has to be labeled with tall man letters, and the high alert medications are supposed to be kept in red bin, and they are having a separate storage. We have to keep it separately, not with other medications, and labeled properly. So this is about improve safety of high alert medications. Now we will see what is our fourth important point, that is ensure correct site, correct procedure and correct patients during the surgery. This is our IPSG goal number 4. So what does this mean? We have a policy for correct surgery, safe surgical assessment, that is we are using sign in, time out, sign out and surgical site marking. So this is very important in ensure correct site, correct procedure, correct patient surgery. So if he or she, a doctor, is going to perform a surgery, this is what we follow in the theater, and before and after the procedure. Site marking is very very important as well. If the site is like for the right leg or left leg, you have to clearly mention, and there is a site marking done prior the surgery. Next, and the fifth point is reduce risk of healthcare associated infections. So friends, for this point we know, being nurses, we are always following this, that is strict hand hygiene protocol, strict hand hygiene policy. So if you're properly washing your hands, this is one of the best method to reduce infection, and you are ensuring safety. So friends, when is the time you will wash your hands? Before touching a patient, before clean or aseptic procedure, after body fluid exposure, after touching a patient, after touching patient surrounding. So these are the 5 times when you will do your hand washing techniques, and you will maintain 40 to 60 seconds of hand hygiene method. Then next is reduce the risk of patient harm resulting from falls. So we have a policy in most of our hospitals, that is initial assessment, ongoing assessment, reassessment and interventions to be carried out. So this is reduce the risk of patient harm. So this were our 6 international patient safety goals, friends. I will repeat: identify patient correctly, improve effective communication, improve the safety of high alert medications. Number 4 comes is ensure correct site, correct procedure and correct patient surgery. Number 5 is reduce the risk of healthcare associated infections. Number 6 is reduce the risk of patient harm resulting from fall. So IPSG goal is one of the very important questions, and you need to know this one to ensure your patient safety. So this video was, hope this video was very effective. So keep watching guys. See you with another video. Thank you for watching. Bye.